Welcome to NCSS Here for You. Since 1958, Northwestern Counseling and Support Services has been providing access to high-quality services which promote healthy living and emotional well-being to the residents of Franklin and Grand Isle counties. Over the years, as the needs of the community have changed, so too have the programs and services that we make available to assist children, adolescents, adults, families, and seniors. We take our role in the community seriously and strive to provide the highest quality services. According to Eric Erickson, a noted developmental psychologist, every person must pass through a series of 8 interrelated stages over the entire life cycle. NCSS provides a continuum of services to meet the needs of individuals who at any point seek assistance. NCSS's purpose is creating a stronger community, one person at a time. Now, let's get to today's show.
I'm Joe Halco, Director of Community Relations for Northwestern Counseling and Support Services, and welcome to another episode of NCSS Here for You. Each month on this program, we discuss a human services topic, and we do that with staff that represent one of our 3 service divisions. Our 3 service divisions are Behavioral Health Services, Children, Youth, and Family Services, and Developmental Services. And on occasion, we have guests from organizations that NCSS collaborates with throughout the year. This month's episode is titled Integrative Medicine for Depression. Mental health is a key determinant of wellness and has shown to be strongly influenced by lifestyle factors such as chronic stress, sedentary lifestyle, poor nutrition, obesity, substance abuse, and social isolation. Use of complementary medicine in mental health conditions has been driven by the high costs of many psychiatric medications and by the growing list of safety concerns reported by the FDA. But due caution must be used with all therapies, both conventional and complementary. How can evidence-based approaches in integrative medicine for depression make a difference? To answer that question and much more, I'm pleased to introduce this month's guest, Dr. David Mooney, NCSS Medical Director. Dr. Mooney, I'd like to welcome you to the program and also take this opportunity to let all the viewers know to welcome you back to NCSS.
Thank you, Joe.
You were here years ago. You've been very highly thought of throughout the state of Vermont, and it's certainly great to have you back here at NCSS once again, and now in the medical director role as well.
Thank you very much. Nice to be here.
So let's start with, what is integrative medicine?
Okay. So integrative medicine, Joe, is really a whole body approach to mental illness. And in integrative medicine, multiple fields of medicine are used: nutritional sciences, we do lots of labs, metabolic testing, nutritional therapies, dietary interventions, sometimes checking for food allergies, things of that nature. I want to stress too that integrative medicine is meant to be used in conjunction with traditional medicine. I haven't thrown my prescription pad out the window, although there might be some days I but no, it's used in conjunction with traditional medicine, and that's how it works the best. But the key thing about integrative medicine is it's really focusing on the individual himself or herself, and designing treatment plans specific for that individual.
Mm-hmm. Now, how did you become interested in this field?
Well, I think for all of us, especially in medicine, I think at some point you have to step back and take a look at everything and say, okay, how is this going? Where's the field of psychiatry now? Mm-hmm. What have we done? What have we not done? Are we meeting our objectives? And psychiatry really, when you think about psychiatry, is not that old. Around the turn of the 20th century, you had Freud, Jung, some other guys came along, Adler, Skinner, and these people. But they kind of started psychiatry, but that was very psychotherapy oriented. And in a way, that was sort of better than what we're doing today, because even though it was psychotherapy and it might have taken you might have been on the couch for 5 years, it was getting toward the cause. Okay, it wasn't so much symptom driven. So that kind of started off, but then, what was it, 1920s or so, antibiotics came out, and then that was followed by, for psychiatry, that was followed by studies for drugs that were used in tuberculosis. And it's actually those drugs for tuberculosis that started the whole movement for psychiatric medications. Our tricyclic antidepressants, which were very effective, still are, came out of that. That was like 50s. You had antipsychotics come out of that. And then in the 1980s or so, Prozac, the first SSRI medication, came out, and followed by many others. But I bring that up because, so okay, we've had this big pharmaceutical movement, and when I trained, we had this whole tool chest of medications that we could use, and it was actually it was a very exciting time. And I think we helped lots of people. I know we helped lots of people. But now, down the road, when we look at some of our treatment options and we look at our patients, we say, geez, you know, could we have done better? What are we missing here? And I would argue that what we're missing is the cause. You know, I like to think of it as, you know, if you take your car to the mechanic, I hope the mechanic would look under the hood. I'd like to think that when you go see a psychiatrist, the psychiatrist would look under your hood. Get some blood work. Look and see what's going on with you metabolically. Look and see what's going on with you nutritionally. That's really what this is all about. I have trouble with the term mental illness because it's not mental illness, or mental symptoms aren't confined to your head. It's your whole body. And I like to think of it more as a system gone awry. Bring that up too because there's a real movement now to be directing our treatment toward inflammation, specifically in the gut. There's reasons why certain illnesses like cardiac disease and psychiatry are together. I mean, how many people do you know that have cardiac issues that are also depressed? You know, it's about inflammation. They're all part of this inflammatory process. And no two heart attacks are the same.
Sure. Yep.
No two bouts of depression are the same. So that's what got me interested, the uniqueness of this whole process. Yeah.
Now, recently, the Center for Disease Control announced a study, and it showed a 24% increase in suicides over the past 15 years. And the highest rate was among girls 10 to 14 years old. Since 1999, the suicide rate for this particular group has exploded by more than 200%. What would contribute to a 10 to 14-year-old girl wanting to commit suicide?
Those are frightening statistics.
Right, yeah, absolutely.
Yeah. Well, I think it's a combination of factors, Joe. I think that 25% increase by itself was dramatic, but it's not just in this country. It's globally. What's even scarier is globally there is one suicide every 40 seconds.
Every 40 seconds?
Yeah. Yeah. Scary thought. So in terms of these young girls, years ago it was thought, well, you know, it's highly unlikely that a child that age would be able to muster up everything to commit suicide. We didn't think it was really that big of an issue. We didn't think they were capable of making that decision, but now we're seeing it a lot. I think it's a combination of three factors. One, I think we have too much of a reliance on antidepressants. I don't want this to be a drug bashing talk by any means, because antidepressants have helped many, many people and certainly have their place. But I think particularly in that population, we've relied on them too much. And if you're going to give someone an antidepressant, that's great, but they need complementary treatment too. They got to have therapy. They got to have some of these things that we're talking about in integrative medicine. And not to mention that some children in that age bracket, when given these medications, are actually activated and more prone to suicidal impulses. That's a big thing. Second thing is, I really feel that the brain is malnourished sometimes in this population, and a malnourished brain can lead to suicidal thoughts. We know that from our work with eating disorders, and believe it or not, the highest rate of suicides of any mental illness are in anorexics, people with eating disorders, and that's because of the brain being malnourished. I'm convinced of that. The third thing is something that we all know, and this is kind of the gas on the fire, which is the social media. You know, people have access to suicide support groups, cyberbullying, and things like that. So those all contribute to the rates increasing.
So depression is a disorder of the brain, correct? Now, you're saying that the brain is being affected by what we're eating. So is eating causing the depression? I thought that the brain was the actual culprit of that.
Yeah, well, the brain controls thoughts, feelings, and behaviors, but if it's not nourished, then it's not working too well. And in fact, there's a lot of research on the essential fatty acids, basically fish oil, and the research in that area is clear that low levels of essential fatty acids are definitely related to suicide attempts and behavior. Not just in anorexic patients like we were talking about before, but also there's been studies with veterans with low essential fatty acid levels and suicide. Yep.
Now, let's look at medication alone versus medication in combination with improved nutrition, and then that versus improved nutrition alone. What are the numbers when it comes to the effectiveness of going in either of these directions?
Right. Well, the sad news is the research on antidepressants were kind of kept quiet by the pharmaceutical industry. Really, the response rate to an antidepressant is really about 50%. It's 50-50. If I give you an antidepressant today, it's 50-50 whether or not you're going to respond to that. Again, that's with an antidepressant alone.
Yes.
Okay? In severe depression, the rates probably, they're more apt to respond. Maybe it's like 60%. They seem to respond better. But important to know that if I give you a sugar pill, a placebo, your response is apt to be 40%. So there's not a big difference there. Yeah, so it's not as big a difference as we would have liked. We don't have good research on nutrition alone, but we do know that if we use the combination of medication and good nutritional therapies, that the chance of having to do the more trial and error guesswork with medications, we have a better chance than if we have to do that. Yeah.
Now, is there a specific treatment plan that you would recommend that uses these nutritional techniques in conjunction with medication?
Well, I'm going to make a plug here for Dr. James Greenblatt, who is the medical director at Walden Behavioral Health in the Boston area. And this is an excellent book which I would highly recommend for anybody with depression or anybody with a family member with depression. And this, what I'm going to be talking about is the ZEBRA model.
Yes.
The ZEBRA, Z-E-E-B-R-A, and it's a model for nutritional therapies for depression. Just a little plug for his book.
Yeah.
He was one of the pioneers and still is in integrative medicine. I've heard him speak several times. So there's the mnemonic is the zebra, and the reason it's the zebra is because if you think about it, no two zebras are the same, right?
Right.
They all have stripes, of course, but the
right,
stripes are never the same. So that's the whole idea. None of us are the same. So the first letter in the mnemonic is T. So that's very simply take care of yourself. Common sense stuff. We all know this stuff. Sleep, avoid stress, eat, whole foods as much as possible. Basically do everything your mother told you to do. What did your mother tell you to do? Clean your plate, eat your vegetables, go out, play with your friends, come home, have a bath, and go to bed. So, so nutrition, exercise, stress reduction, and sleep. If we listen to our mothers,
we
yeah,
would be better off.
Yeah. Second, the H is for hormones, real important. Especially, I see lots of women who come in depressed, they've been gaining weight, they're cold intolerant, their hair's brittle, they've got all these symptoms that add up to thyroid issues. Very easy to check for thyroid hormone, very easy to treat. Testosterone, we used to kind of avoid testosterone. We thought it was, we always have associated testosterone with bodybuilders and stuff, and we think of it along those lines, but as men age, the level of testosterone goes down, and that's really easy to treat and brings up energy and brings up mood too. So that's an important one. The E in the is for exclude. For that, so that's excluding foods, in particular for people who are susceptible to gluten. Gluten sensitivity, gluten allergy is very common, leads to celiac disease in some cases. Celiac disease is basically a disease of the body attacking itself. And what often happens is that it's an immune response in the intestines. And you can think of little pores. There's gap junctions. Cells are tight together like this. And with gluten, these gap junctions kind of open up, so it becomes porous. So basically, particles, food particles or whatever in the intestine can leak out into the bloodstream. Not a good thing. Leads to all these symptoms that people have with gluten, which are, multiple GI symptoms, headaches, depression, and things like that. So gluten is in wheat, barley, and rye, if you didn't know. Z is real important. Zinc and other minerals. Zinc is good for immune response. It is involved in the pathway toward making neurotransmitters, so it's a huge cofactor. Again, helps to stabilize mood. It, along with magnesium is also involved in that same pathway. I'm using lots of magnesium with the kids that I'm treating. I find it really effective for things that kids have. They have sleep problems, they have anxiety, they have constipation. It's real effective, but also helps with mood. And important to know that of all the minerals, magnesium is probably the most lacking.
Oh.
Yeah. Lastly, in terms of minerals, would be lithium. Everybody's heard of lithium, mostly in the context of treating bipolar disorder. Typically doses of 600 to 1,200 milligrams or somewhere in that range. That's for bipolar disorder, what used to be called manic depression. We're using small doses like 1 milligram or 2 milligrams of lithium orotate, which is naturally occurring lithium. There's lithium in water. Do you remember 7-Up?
Yes.
Okay,
Yep.
7-Up, the 7 in 7-Up is for lithium, because lithium is number 7 on the periodic table of elements.
Oh.
Probably learned that in 7th grade. Yeah. But that's true. So small amounts of lithium, yeah, but that's a whole different treatment than when we're using lithium for bipolar disorder. Yeah. Okay, and then exercise. Well, of course, if you're depressed, it's hard to get up off the couch and join an aerobics class. I don't need to talk much about this. We all know that exercise benefits us. We all know that it releases endorphins that help with mood, sleep, and the immune response. The E in the other E in zebra is, again, for essential fatty acids. Want to stress how important they are because they're so easy to replace. Like 60% of the dry weight of your brain is made of essential fatty acids, and probably 25% of the white matter. The white matter is where the axon, the nerves all talk, and where the action happens. That's made up of essential fatty acids too. And their essential fatty acids are very involved in supporting neurotransmitters like the other things that I've mentioned. Sometimes we check for inflammation. I bring up inflammation again with C-reactive protein. C-reactive protein is very nonspecific. It doesn't tell you exactly what's inflamed, but I can get a C-reactive protein and know that there's a good chance that this person is going to respond well to fish oil. Nice to know. Again, it doesn't tell you exactly where the inflammation is, but it does also tell you how everything is linked. And also we know that people with low essential fatty acid levels are more prone to depression and suicide. Little thing about cholesterol. We're taking Lipitor like they're M&Ms now, you know, and again, Lipitor is fine. People need it, and it really helps them. And I don't want people stopping their Lipitor. But it's important to know that sometimes people, the cholesterol levels should always be about 200, you know, around there. Sometimes people's levels get as low as 150, 160. Don't stop your Lipitor, go talk to your doctor, but you need to know that, you know, there's some cases of people getting really irritable, anger, really low levels of cholesterol can affect your mood too, because cholesterol is an important component of cell membranes. So that's helpful to know. Eat the little fish, you know, for fish oil, you know, the sardines, you know, the anchovies. Yep. Next is B vitamins. I bring that up because sugars and carbohydrates reduce the levels of B vitamins in our blood. Real easy to replace those. Folate, all pregnant women should take folate prenatally. B12, very important vitamin in depression. And R, one of my favorite topics, which is restore, that's about our gut. We need to keep our gut healthy, and we can restore that with probiotics. The gut is actually becoming becoming thought of as the second brain, because there are 95% of your serotonin receptors are in your gut. And when we're giving drugs, we're working on the serotonin receptors in the brain. Well, they don't work just on the brain, but the fact is a lot of action with serotonin is happening in the gut. If we can treat the gut effectively, we can treat the whole body, because the gut communicates with the brain. There's a big nerve, cranial nerve 10, the vagus nerve, which runs from the gut to the brain. And so there's messages going back and forth. It's like an interstate. If you get butterflies, okay, butterflies are in your stomach, you get butterflies because you're anxious, you're in your head, and that makes you have butterflies. So there's messages going back and forth. Yeah. So I think of the gut as like the roots of a tree.
Yes.
If you nourish those roots, then the tree will grow well. So very important. Lastly, are amino acids. Bring this up just because people take lots of over-the-counter acid reducers or by prescription as well. That's great. You need them. Don't stop them either. Talk to your doctor. But you need to know that we need a certain amount of acid to break down proteins and get amino acids, because amino acids are the building blocks of cells and proteins. And so if you need acid reducers, great, take them. But just be careful and don't overdo it, because you can't actually interfere with your whole nourishment. If you're interfering with your nourishment, then you're potentially interfering with your mood. So that's the zebra model.
That's fascinating.
Yeah.
You know, the other thing in listening to that, Doctor, is that when we always talk about when individuals are, say, on more than one type of prescription, or what's the interrelation between them and maybe some over-the-counter or supplements that they take, and I would imagine, again, because you're treating the individual, that's all a part of trying to work all that out with this model.
Right.
As to what does that mean.
Right.
What could be deemed as helpful to someone depending on their circumstances.
Right, and most of us don't know. Most of us don't have the opportunity to talk with our health provider, you know, about these issues. That's why I think it's important to get it out there. Most people need to also know that this doesn't necessarily have to be about taking psychotropic medications. There are plenty of other options, again, in conjunction with psychotropic medications. I've also seen plenty of people, here's an example, I've had people come in and say, and they're depressed, and they want to start an antidepressant. Maybe they have a mild depression, okay? And I'll say, rather than start an antidepressant right now, how about we start these therapies? I'll typically give them a fish oil, multiple vitamin, probiotic, vitamin D, very important. And say, let's give that 6 weeks and see where you're at, because it's going to take at least 6 weeks. It actually takes months for antidepressants to kick in. So let's see what kind of response that you get with this. And if you're showing some response with this, maybe we don't need to go with the antidepressants. Yeah.
Now, does this treatment work better in younger people than older people, or really does it depend on the level of depression that has been diagnosed?
It's really for all ages, but we do know that the elderly and the adolescents tend to be more responsive to nutritional interventions for some reason, but everyone should have, at the very least, their vitamin D levels and their B12 levels checked. So easy to supplement those. It doesn't mean that everybody with depression is deficient, but it provides a good foundation for the therapy that's needed. We live in Vermont, we don't get much sun. We need vitamin D. Yeah.
Now, is nourishing the brain the same as nourishing the mind, or is there a difference when it comes to the zebra approach?
So the zebra approach for nourishing the brain gives us, the big picture of how nutrients affect depression. But then we do need to turn to the mind, to nourishing the mind, and I think we all know what those techniques are. Things like yoga, meditation. We just know those are good for us, and there's oodles and oodles of studies on those being very effective for depression. Also, the psychotherapy, huge. Sometimes psychotherapy ends up playing, behind medication, and it shouldn't be, because those two are very, very integral and very interrelated. But also spirituality and faith. It's very important that people have strong faith, and that helps mood, that helps depression. Doesn't have to be in an organized religion, but having faith, people respond better to treatment, and they just do better overall. Yeah.
Well, when you say faith, that reminds me as well, is that, people need to have that feeling of hope.
Yes.
Because hopelessness, of course, can lead to a lot of what we've been talking about today.
Yeah.
But certainly the fact that there is hope in whatever, however they're traveling, whatever path they're leading.
And being with other people.
Yes, not in isolation.
Very, what do depressed people do? They isolate. How do we fix that? Be around other people. It's just important to keep those social connections.
One final thought here before we have to leave is that, and we can do another show on it, but it's rather fascinating that today we're in a more connected world than we've ever been in before, with the various hand devices and just every other way that people could communicate today. And yet it seems, as much as we can communicate in an electronic or digital world, that we have lost a lot of the soft skills of being able to talk like you and I are today, and of people being able to get together in groups and not be isolated. I mean, talking to someone maybe on the other side of the world via Facebook or what have you is wonderful. But if you don't have anybody locally in your life that you're talking to in person, I think that can sometimes lead to isolation, even though they're connected.
Right, right. And I think too, when we're adolescents, when we're in high school, before we've reached adulthood, that's when your brain is really laying down tracks, learning how to establish relationships, how to talk to people. And oftentimes that whole process is being missed by what's going on with electronic devices and all that. So there's a whole piece of socialization that is being missed, I would argue, which is very important. Helps you later on in life. Yeah. But that's an interesting point.
And it's one that there was a recent article, I think it was in the New York Times, that talked about the extreme high anxiety in adolescence. And that's what made me think of it, is that trying to put myself in the place of someone who's an adolescent and having grown up with devices, virtually your whole life, as opposed to having it come in much later in life, and how you're able to work with those devices, and as you say, the development of the brain versus the development of what that device can, or where that can take you, that's in your hand or your computer or what have you, are really two different levels. And are you ready for some of what you may be, quote unquote, exposed to?
Yeah, those brains are just developing at that. They're still developing at that time, laying down tracks.
I want to thank my guest, Dr. David Mooney, for being on the show today and sharing his insights about the integrative medicine and the many positive possibilities that it can have on the management of common conditions such as anxiety and depression. Now, before we go, it's time for the NCSS Factoid of the Month. The Developmental Services Division's Community Employment Services Program has demonstrated positive outcomes for individuals with intellectual disabilities, for the community, and for the state as a whole. The objective of the program is to assist persons seeking employment to choose, obtain, and retain competitive, integrated employment in the community. Program indicators are to develop and maintain meaningful job placements and to increase the Social Security savings. The story behind the performance shows that the Developmental Services Community Employment Program has produced a 33% increase in the number of clients employed over the past 5 years, while total wages earned have gone up by more than $146,000 over the past 5 years. And that's with total Social Security savings nearly doubling over those same 5 years. What makes the program a success is that NCSS provides supportive employment by building natural supports on the job site. NCSS supports skill development to help encourage individuals working to be as independent as possible on the job. This approach increases a person's self-esteem. We work in tandem with community partners such as Creative Workforce Solutions, Voc Rehab, as well as local schools and businesses. This is yet another example of NCSS creating a stronger community, one person at a time. NCSS, you may not know us until you need us. I want to thank you, the viewer, for spending time with us again this month. You can learn more about NCSS and all of our programs and services by going to ncssinc.org. I'm Joe Halco, and I'll be back next month with another episode of NCSS Here for You.
This has been another episode of NCSS Here for You. We hope that you found today's discussion informative and educational. Since 1958, Northwestern Counseling and Support Services has been providing access to high-quality services which promote healthy living and emotional well-being to the residents of Franklin and Grand Isle counties. Over the years, as the needs of the community have changed, so too have the programs and services that we make available to assist children, adolescents, adults, families, and seniors. Thanks once again for tuning in this month. NCSS's purpose remains creating a stronger community, one person at a time.